The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Good evening everyone. Welcome to a brand new episode of BMC Global Live Al Hilal Health World Nothing But Lifestyle. In each episode of this talk show, we bring before you an expert doctor to address your health queries and to assist you in your journey towards good health. Today the topic of discussion is recurrent urinary tract infection. In this hot weather, in this part of the world, I think it's an important topic to discuss. We have Dr. Shabin Anas. She is a specialist urologist from Al Hilal Hospital, Muharraq. She is an expert in the field of urology. Let's welcome doctor to the show and move on to the topic. Hello doctor, welcome to the show and thank you very much for being here to discuss this relevant topic. Today's topic, let's move on to the topic. What is recurrent UTI? Please explain.
Dear, in fact, before explaining the recurrent UTI, I will tell you about the UTI. What is the UTI? I previously talked about the UTI too, but it's better to explain the UTI again. In fact, in UTI, urinary tract infection, we call it. It is the inflammation of the urinary tract epithelium by the bacteria or any organism, okay? And the urinary tract includes bladder, urethra, kidney, ureter, everything. And what is a recurrent UTI? Recurrent UTI, if a patient gets 2 episodes in last 6 months or 3 episodes in 1 year, we call it recurrent UTI, okay? And but recurrent UTI can be the relapse of the UTI, or it can be reinfection. What's the relapse and what's the reinfection? If a relapse is the infection of the urinary tract coming back after 2 weeks of treatment of previous UTI,
Okay.
and the organism means we do the culture for the
Urine.
UTI, and the organism is the same for the relapse. And but in the reinfection, you get the infection with a different organism, and the recurrent UTI is much more common in female than the male.
Okay. Doctor, any special causes for this recurrent UTI?
Certain etiologies for having recurrent UTI. Most important are the anatomical defects. Means anatomical defect, what they happen, they keep the urine in obstruction form, means they can lead to obstruction, stasis, sometimes reflux.
Okay.
And reflux is much more common in kids. Almost 40% of the kids who are presenting to us with first UTI, when we investigate them, they have VUR. We call it VUR, means reflex. And there are the functional abnormalities like the overactive bladder, urine incontinence, cystocele, and sexually active females, older men and women. Older men can also get the recurrent
Is it?
UTI,
Okay.
but they have certain causes inside. No? And other causes, maybe if the patient is having stone, patient is having any neoplasm, if the patient having any abscess, a foreign body inside the urinary tract, this can lead to the recurrent UTI.
Is it women are more prone to UTI?
Yeah, yes.
Then
Females are
recurrent
more.
UTI also same.
Yeah, it's the same with the recurrent UTI, because means I'm telling you how frequent is the urine tract infection or recurrent infection in the female. In fact, one in a while, means one in a year, before 24 years of age, female can get UTI infection. Okay, and according to one study, almost 53% of the older women more than 50 years of age, they can get the recurrent UTI, and 36% of the younger women.
Okay. What are the tests to be done to diagnose this UTI?
For the diagnosis, it's better to first take the history. Okay, the history is very important regarding the diagnosis, and then the physical examination. Basically, the patient presents with the dysuria, frequency, urgency, suprapubic pain, and we call it uncomplicated cystitis. Regarding females only, no? I'm talking about the females only.
Yeah.
And but if the patient is having fever with the rigor and chill, or they are having flank pain, then we call it complicated UTI, and it spreads to means the kidney like this. And when we examine the patient, sometimes they are having suprapubic tenderness, and sometimes they are having tenderness in the costophrenic angle, and they are having high grade fever. And then we proceed with the investigation, and the investigation for the diagnosis, we need only 2 or 3 investigation initially. We do urine test, urine routine analysis to see the means how many blood WBC are there, what's the pH of the urine, and then we proceed with the urine culture. Urine culture is very important because we diagnose the UTI with the culture. Okay. So culture is very important. So we do routinely urine routine and urine culture. If the patient is having fever, to seeing the patient how much the infection has spread, what's the TLC count of the patient, then we do the other tests, CBC and like this. And for the patient who are, I told you before, the relapse of the UTI. Okay. So for the UTI relapse, we see patient is having anything inside of their urinary tract system which is leading to the infection. Most commonly it is chronic prostatitis, or it's bladder stone, or any abscess. To see that, we do ultrasound, we do CT scan, all the investigation. All the investigation are accessory investigation we do.
So the normal case, you do the culture first.
Urine RE, urine routine we call it, urine routine analysis and urine culture. it's must for the recurrent UTI if we are,
find
we
out.
are saying, yeah.
Okay.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Doctor, can you explain the treatment options of recurrent UTI?
For the treatment of the recurrent UTI, in fact, basically most of the time we tell the patient to maximize their personal hygiene, because there are certain personal hygiene factors which lead to the recurrent UTI. First, most of common is they are not washing from front to back. They are washing it correctly. They are washing from back to front. Another is they're not washing hand before voiding the vagina, okay, after voiding. Another, if they're not voiding before and after intimation, okay, use of spermicides different, and they're using bath instead of shower. This leads to the recurrent UTI.
Okay.
And if they are having multiple sexual partner, and these all things leads to
Okay.
the.
So when patients come to you, you have to educate them.
Yeah,
About the-
we have to educate them. We have to tell them regarding the different risk factor. These risk factor can lead to the infection. Means if the patient is having chronic diarrhea, if the patient is having atrophic vaginitis, okay, if the patient is having first UTI at the early age of and they are having increased frequency of sexual activity, that if the patient is diabetic, okay, and if they are not voiding, means they are taking long time for voiding, means there is a long interval between that voiding, means we sometimes the bladder is incomplete empty because of some neurogenic diseases. A diabetic patient also have means incomplete, sometimes incomplete emptying of bladder, or they are not taking too much water, okay. These things can means these are the most risk factor for the recurrent UTI. So when we are educating patient, means how to avoid or how to prevent the recurrent infection, we always tell them, please take almost 2 liters of water per day, okay? Don't use the spermicides with the diaphragm or the condom, because this is the one of the risk factor. Okay, they have to avoid before and after intimation, okay. They have to go to washroom regularly, means it's better to use the washroom every 3 to 4 hours once. It's must, because if the urine staying for longer period of time inside your bladder, it will cause infection, okay. Try to take the showers rather than bath. baths, and don't use that loafers and reusable
Okay.
sponges. Okay, you can use washable clothes, you can use toilet paper, you can use baby wipes, but
Okay.
always use them from front to back. Okay, and only use them once only. Okay. And always wash hands before wiping, because it also leads to the infection. Another thing is only take the antibiotics according to the prescription of the doctor.
For other diseases.
No, for this, for recurrent UTI.
Okay. Oh, not over the counter.
Or not all the.
Okay. Doctor, do you find recurrent UTI in children also?
Yeah, in the children they have, but in the children they have some reason behind. I mean, maybe they are, I told you, they have visual, means reflex, vesico-uretaric reflex in 40% of the cases. And the females, the kids, what happened, when the mothers are wiping them, means washing them after urination or after passing stools, the mothers are washing. When they are going to schools, what they do means they don't know how to wash. They wash from back to front. Sometimes they don't know, means they use tissue paper or not. They don't wash properly.
Don't wipe
and
also.
these things can lead to the recurrent infection in the children too.
And they don't drink water also at school. That also reason.
They don't drink water too much, and it also leads to the recurrent infection.
Okay.
But means there is always some reason behind when you are having relapsing infection. And regarding the treatment purpose, when we are educating the patient regarding the personal hygiene and all that matters, we also tell them to take the medication. Means we also prescribe them the medication according to cultures.
Okay.
For the treatment purpose, like I discussed before, we ask the patient to correct their personal hygiene matters. Okay, maximize them. Okay, don't use the spermicides. And take the antibiotic which the doctor prescribes according to the culture. And we sometimes give them the prophylactic antibiotics, means for the married couple most of the time.
Okay.
And sometimes we give them the low dose antibiotic for prolonged period of the time. But for the patient is always that don't wear the loose tight clothes, always wear the loose clothes, and always try to take the medication according to your doctor prescription. Means don't take the prescription over the counter. Means that the doctor will prescribe what is better for you then.
That's very informative.
It's okay.
Doctor, what is the prognosis of recurrent UTI?
Prognosis of the recurrent UTI is not bad. Okay, means if until unless it's not complicated, and a patient will be okay after taking medication and removing the risk factor, making their that personal hygiene good. They will be okay. Means their prognosis of recurrent UTI is okay, but if the patient is having stone, or if the patient is having chronic prostatitis like this, we need to treat that. Otherwise, until unless we are not treating the underlying cause, the patient will not be okay.
Why are women more prone to UTI than men?
The women are more prone to the UTI, recurrent UTI. There are 2 or 3 factors. No? The one thing is that they have very small urethra and close proximity to the vagina too. And whenever means something happens, like means they don't wipe properly, they don't wash properly during the periods, they don't care much about the changing of the pads every 4 hours like this. What happen are they are wiping from back to front. What happen, the bacteria comes to in front and they infect the vagina, then they infect the urethra. And when they infect the urethra, the patient suffers from these UTI symptoms, and then this infection means go to the bladder, and then bladder get infected, and then the patient having the urgency and frequency, this kind of the symptoms. And this infection can also go into the ureter, then in the kidneys. That's and it's we call it ascending infection. Means it's going from down to up. And the other infection from the different parts of the body is very rare, but for the female, it's common because of their short urethra and close proximity to the vagina. And this is the vagina and the anal canal.
Okay. Okay, doctor. If the UTI comes recurrently, will it affect the internal organs like kidneys?
Definitely, it can cause, means if the patient is having complicated UTI, means complicated UTI means they are having fever and chills, they are having pyelonephritis like this. If the infection is sending infection have reached up to the kidney and it causes, means why they reach up to, means when you are not properly treating the infection. Okay, when the infection is not properly treated, then it's ascends, and it means it causes infection in the kidneys. Are the patient with the VUR, means in the reflux patient, or in the stasis patient, they can get the infection in the kidney. We call it pyelonephritis. If the patient diabetic, then it's more severe. Then means we can say it will cause the infection to the kidney. Because, but there's some reason behind, means if you are having VUR, means reflux, any stasis because of the stones or something obstruction, this static urine can get infected, or the patient is having any infection in their body and means from the blood the infection is spreading to the kidney. If the patient is diabetic and or you have done any recent surgery, mean instrumentation in the urinary tract, this is also lead to the infection, ascending infection up to the kidney.
So using catheter like that also?
Yeah, catheter, when the patient is having catheter in situ. Okay, the foreign body, when I was talking about the foreign body, the catheter is also the foreign body. Not so if the patient is having catheter in situ or any other foreign body, this can lead to, means foreign body like the digestion. After the surgery, we put the digestion inside. It can also lead to the infection.
Doctor, my last question is, any advice from your side to our viewers?
Advice to you viewers is the same, means I told them before, the personal hygiene is very important. Okay, and to drink a lot of water, always try to wash from front to back, and always avoid before and after intimation. Always take the medication according to the doctor. If you are not okay with anything, if you are not feeling good, you're feeling I'm not okay, please always visit your doctor.
So thank you, doctor. Thank you for being with us.
Thank you so
and
much.
Giving us a lot of information about this recurrent UTI. It is very informative. Thank you once again. So viewers, as doctor told us, prevention is better than cure. So stay happy, stay healthy. This is Jasila Mujib signing off. See you all in another episode of BMC Global Live, Al Hilal Health World, Nothing But Lifestyle. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, Governments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.